This is Caring for You from the Waupaca Senior Center.
Well, I'll go ahead and start, and if somebody comes in, that's okay. So I met some of you, so Mary and Carolyn and Cheryl.
Pat Mather.
Pat, hi.
And Lynn Weiler.
Hi, Lynn. I'm Mary Vogt, and you're? Josh. Josh is here from the public television station, right? Yep, to record this as well. And I work with Theta Care, so with home care and hospice, and of course, the Waupaca Hospital, the Waupaca Physician Group. So it's a big organization, and we like to get out and share some information that we've learned that can help people avoid, in this particular instance, a care crisis. So I'm going to go over some things that are helpful to know for you and friends that you have and loved ones about hospitalization, and as we age, some of the things that can occur and how to be prepared for some things and avoid a crisis situation with that. So we've done this presentation with a lot of organizations, and usually people find it pretty useful, so I hope you do too. So the objective is to be able to explain the difference between an inpatient and an admission to the hospital as outpatient. Have you ever heard of an outpatient admission to the hospital? So just because you're in the hospital doesn't mean you're inpatient, so we're going to talk about that. Why having an advance directive is important. To be able to create a plan for post-hospitalization and understand why it's important to know about your health care benefits. So being prepared, so having your driver's license and another form of ID, you probably have that in your purses, really important to have that available, and a list of all prescription medications that you're taking. So every time you go to the doctor's office, if you're going to the Waupaca Theta Care physicians, they'll give you what we call an after visit summary, and it has your list. So it's a good idea to keep that in your purse as well, because wherever you are then, somebody has access to, here's the medications that Cheryl is on, so we would know in an emergency. And it will also include your list of allergies and medical history if you have any. The names and phone numbers of providers you're currently seeing, so that would be on that visit summary as well. Your insurance cards, and to research your insurance benefits ahead of time to understand. So does everybody here understand everything that your insurance covers or doesn't? Who does, right? They ought to put a question mark on this one. It's complicated, believe you me. So if you don't feel like you do, please, you are in big company. And I work in healthcare, and I don't always understand it. I had a call the other day just to understand my dental coverage on something. So to have your advanced directive paperwork in place, and then contact information for an emergency contact. So if you're not able to, at some point in your life, you might not be able to express your needs and your wants. So does everybody here have a power of attorney, a healthcare power of attorney? I see two heads nodding. Cheryl, do you have one?
I have a living will, but I have to update because
Okay.
I went from the other one to here. So
Okay.
You know I have
Great, then this is very timely for you. Okay, Mary and Carolyn, do you have an advance directive?
I've got my daughter and I updated ours about 2 years ago.
Wonderful, excellent, so it's updated, and she's your agent?
Mhm.
Great. And Carolyn?
Carolyn, do you have a power of attorney or your will, living will made out?
I don't know. I don't pay any attention to it.
Okay, so what, for example, in Mary's situation, her daughter would be able then, if she was not able to speak for herself, her daughter would be authorized to speak for her. And one of the things that's really important is that her daughter understand what Mary would want. So if you have a power of attorney, power of attorney is not exactly the same as a living will. It's okay to have both. But a power of attorney is really helpful because at some point, if after surgery or something you weren't able to speak for yourself, the power of attorney gives the person you designate the ability to speak for you. Now, that only works if you are not able to speak for yourself. You can revoke it at any time. As if you have good conversations with your power of attorney about what you would want or not want, then they'd be able to do as you would want to have happen if you couldn't speak for yourself. So an advocate, your agent, can also be an advocate for you to understand what the treatment options are and get clarification about what exactly it means and what are the benefits and what are the risks, and help with planning a discharge after the hospital if you were in the hospital, including getting your prescriptions and groceries and making sure that your home is safe for you while you're recuperating from your hospital stay.
What do you mean by your agent?
So an agent is often, an agent could be your healthcare power of attorney agent, or it could be just an advocate, someone who is a family member or a neighbor or somebody who is going to help you if you are hospitalized and then coming home after.
So you don't have to have that name listed?
No,
Oh.
you don't
Could be
have to.
anybody.
Could be anybody, yes.
Oh, okay.
Yep. Because after a hospitalization, it's pretty likely all of us would need a little help. So understanding who would be able to help me, you know, just pick up my medications at the hospital or at the pick up my make sure I have my groceries, somebody that can help you. So thinking about that ahead of time is really useful. So an advance directive also is a kind of power of attorney, and what it does is with the power of attorney document, it also provides the opportunity to talk to your agent and your family members about what you would want if you were unable to speak for yourself. It provides the name of the person that you are appointing as your agent, and it clearly defines what you would want in terms of medical care. So it's a useful document to have if you're not able to tell the doctor yourself what it is that you would want or not want. So you can download and print a document from the state of Wisconsin, and anyone from ThedaCare can give you a document as well. It does not need to be done by an attorney. It can be done by you and your agent, but it does have to be signed by 2 witnesses that aren't related to you.
But
So-
you really don't need it.
You would need it if you were unable to speak for yourself.
Now you're talking about this agent or?
A health power of attorney.
Oh.
Right. So if at some point you were not able to speak for yourself due to an injury or an illness, your agent would be able to speak for you, and that's a power of attorney. They have the power to be your spokesperson, and we call them an agent.
See, I'm having a trouble.
Go ahead.
Maybe I'm dumb or something.
No, it's
I'm having
complicated.
trouble, between the power of attorney and agent.
They're the same thing.
So my power of attorney is my agent.
If it's a power of attorney for health
Your
care.
husband could be your
Yeah.
agent.
Well,
I don't have a husband.
No, but your power of attorney the power of attorney is a document,
Yeah, right.
okay?
I have that.
And that
Yeah.
document is, if it's for health care, it appoints the person you want to speak for you.
That's my power of attorney, but that's my daughter who's
Yes.
way down in Mississippi.
Okay, so that might be a little complicated, wouldn't
Yeah.
it? So you might want to revisit that. Is that still a workable agent for you? If you needed someone to speak for you, she would be a long way away. So you can update that document
Yeah.
and appoint another person as your agent.
So in other words, I could update it and appoint, say, my neighbor
Yes.
to get my prescriptions if I need them or whatever.
The agent is somebody that if you weren't able to speak for yourself, they would have the legal right to speak for you.
Yeah. Okay.
So a neighbor might be a great person if that's someone that you trust to be able to speak for you, and that person also knows what you would want because you've had a conversation about it.
Someone who want you to know if you want to go on
Yeah,
100%
right.
life support.
Right.
But if I have a power of attorney, I don't know if I need an agent. See, my power of attorney would.
And your power of attorney is your daughter, is that what you're
Right.
saying? Yes, your daughter is your agent. The agent is just another way of saying your power of attorney.
Okay.
Okay, but if you are not able to speak for yourself and your daughter is far away, it might be complicated,
Right.
but it's up to you who you want to be able to speak for you.
Yeah.
You have only one person
I
in that role?
I do. Yeah.
So
Is it a good idea to have more than one person?
you can appoint a second person, and actually a third. So you can have, so if your daughter said, I can't get there for 2 days,
Yeah.
I'm letting the second person do it, then the second person who's somebody local could be that.
But don't you, on your will or something, don't you have it written even like on for the doctor, do not resuscitate or
Mhm.
and so that's legal that way too, isn't it?
It is in Wisconsin, so that's another kind of healthcare treatment is to, if your heart were to stop or your breathing would stop, then some people choose to not have the compressions and not have the mouth-to-mouth. And that's an opportunity to have a discussion with your doctor about, would I want this? How effective is it? As we get older, it becomes less effective than it was for a younger person in their 40s who maybe has a sudden heart attack. If you're in the hospital, the ability to do that successfully is more probable than if you are in the grocery store, right? So the closer you are to the hospital, the more successful that can be. So that really requires some conversation and understanding what does it really mean and what would I want for myself. So you can have your doctor write that order, but what's important, Mary, is in Wisconsin, you have to have a community band on. You have to wear a band at all times in order for that, your wishes to not be resuscitated, your wishes to be followed. In Wisconsin, yep, and you're looking like, what? That's yes. So if your wish is to not be resuscitated, and I should say attempt to be resuscitated because it's not always successful, and in the hospital it might be 17 to 22% that you would actually walk out of or leave the hospital. Out in the community, it's much, much less. People who have a lot of other illnesses, it can be as low as, let's say, 3% in the community. The other is, even if you do survive the attempt, you're not always without complications. So there could be complications, and you want to think that through. What would you want to do? So when you're in the hospital, they'll always ask you, do you want to be try an attempt a resuscitation or not? But that only applies while you're in the hospital. When you're out in the community, in order for your wishes to be followed, you have to have what's called a community bracelet. And you can get that at your doctor's office and ask for, next time you go in, say, I want a community bracelet. I don't want to be resuscitated if my heart stops in the grocery store. I want to be made comfortable. I don't want anybody rushing me to the emergency room. That bracelet authorizes the ambulance to not treat you. If you don't have the bracelet on, they by law have to attempt to resuscitate you. So a lot of people don't understand that. It's not really clear to people.
I know an incident where she didn't have the bracelet and she was in the ambulance and they did resuscitate her and she did not want to be, but they had no choice.
Mm-hmm.
Yeah.
Right. So you can get one at the doctor's office, and they start with a plastic one, but you can get, they can give you information on how to order a nicer looking metal one or different ones. Kind of like those medical ID bracelets. Have you ever seen those? Yeah. So good question. Thanks for asking that, Mary. That was really a big clarification.
I know Charlie on my form down at the hospital, it's on there that I don't know.
Is that Dr. Rathjen?
Yeah.
Yeah. Yeah. So
I told him, Charlie,
I know him. Yeah, I know him. So next time you're in, ask for a community bracelet, because otherwise no one is going to be able to know that you don't want that. So if you were here and your heart stopped, they'd have to call 911 and they'd have to resuscitate you.
But that's a big decision.
It is a big decision. You're very right. And that's why you should talk to your doctor about it. Is this the right thing for me? What would it mean if they did it? What are my chances of having the kind of life that I want? What's important to me?
Yeah.
Right? So it sounds like Mary's had that decision and is pretty clear. So she'll be able to then take some steps to make sure that your wishes were followed. I had to do that with my mother too, and my in-laws actually both wear a bracelet, and they live in independent apartments but in a large complex, but they both wear a bracelet. Good. let me go on here. Let's see here. Oop. Go away. Go away. Okay, so the idea is to be ready for the unexpected, because the unexpected, right, just happens. So you want to have your account number, your financial information all kind of in one place. So if your son or daughter or someone had to organize it, they'd have it all together. You can actually have a financial, I'm going to get confusing, a financial power of attorney who is only authorized to deal with your money. Okay, that's different than a health care one, but you can have a financial power of attorney as well. Your appointee should know where you have all your papers. And so, for example, I made copies of all of my stuff and sent it to my daughter who lives near me and my son who lives in Montana. So if anything ever happened, here's the information that you need. And in case of an extended hospital stay, you may have hospital bills and other bills that are coming to the house, right? Somebody needs to be able to pay those, and that would be a financial power of attorney who can access your funds and pay your bills for you. So another thing to think about. So if you go to the hospital, you probably want to come home, right? Sometimes what we find, though, especially if you're recovering from an illness, let's say you had pneumonia for a couple weeks and it was a little complicated, it's surprising how much being in the hospital can weaken you, and you might not really be ready to be home right away. You might need some more daily support in order to be stronger back to your more usual self. So what if you're not able to return home all the way? To think about that. So when you're admitted to the hospital, there's two things that can happen. One is an inpatient stay, and most people think when I'm in the hospital, I'm an inpatient. And your benefits, when you look at your health care benefits, you'll see there's inpatient coverage and outpatient coverage. Now we think if I'm only going into the lab, that must be outpatient, right? I'm not in a bed, or I just went in for an x-ray. But you can actually be in a bed and still be an outpatient, and I'll give you an example of how that happens. So let's say I'm feeling like my heart is feeling kind of funky, and I'm going to the emergency room, and they say, here, we ran some tests, and we think it's this, and we're just going to give you some medication to see if it works, but we want to keep an eye on you while that's working. So we don't want you to go home. We want you to stay here, and you might stay overnight. We're going to keep an eye on you. That would be an outpatient or an observation status. So your insurance would cover that differently than inpatient, even though you're in a bed. So there are rules and regulations that the doctors are required to follow.
You're still taking up a bed?
You're taking up a bed, yep, but your insurance is going to pay for it differently if it's observation versus inpatient. So you might ask, well, am I in observation or am I inpatient, if you want to know how your insurance is going to cover. But that's usually a surprise to most people, that there's two different kinds of ways your insurance will pay for it based on, are you there just for us to keep an eye on you to see if the medication works and then you're going to go home? Or are we doing a lot of workup and treatment and testing to see what's on and really doing a lot? So that's a little bit different. And it also, it might change how much you pay out of pocket, and it might determine whether you would qualify to use your Medicare benefits for a rehab stay in the nursing home, what we call skilled rehab. So you might have heard of the three-day stay. It's actually 3 midnights. And whether you are observation or inpatient status makes a difference for this. It has to be an inpatient status in order for your inpatient. Now, I wish Congress would come back and change that, because when they wrote these rules back in the 60s, people stayed in the hospital a long time, and 3 days seemed reasonable then. 3 nights. It isn't that way anymore. I mean, people can be inpatient for a day or two. So it's really unfortunate. Okay. So if you have straight Medicare and inpatient, Medicare A covers your hospital stay, and Medicare B covers your the doctor costs. If you're an observation, it goes under Medicare B, and it covers it as an outpatient stay. So it's a little bit different. So I'm not going to go into the specifics on this because it's pretty complicated. Just so knowing whether it's inpatient or outpatient can help.
So in other words, insurance probably doesn't pay outpatient too much.
It usually pays less
Yeah.
than it does for inpatient. So what is a care manager? So if you're in the hospital, one of the things that'll happen is a care manager will come and say, Mary, I'm your care manager. I'm here to help set up anything that you might need once you go home. So do you think you might need some home health care services? Are we going to be setting you up for an appointment to see the cardiologist? So they're really helping to organize so that you'll be ready to go, everything's in place. They'll talk to you about what do you need at home. Do you have steps to go up and down? So if you've got your laundry mat or your laundry in the basement, but you've hurt your foot, right? They're going to talk to you about that. So how are you going to get your laundry done once you go home because your laundry's in the basement? They'll talk to you about your insurance coverage, and they're pretty good at answering most of the questions about insurance. They're really knowledgeable. They'll set up the services for you. They'll make sure that your appointments are set up. And what the idea is to make sure that you have everything that you need so that you'll be safe after you leave the hospital. So preparing for going home, sometimes you might need a walker or a wheelchair or a raised toilet seat or some railings on the bathtub. So they'll help assess what is it that you're going to need in order to be safe that you might not have now. And they'll help get those things set up. And they'll also talk about, well, who is going to help you then when you get home? Do you have a family member that can be with you? Do you have a neighbor who might be going to pick up your groceries for you? So they'll think through all the things about what happens when you go home, and they'll help you sort it out.
Now, excuse me, they actually have people who can help get your house in shape, like putting up railings and that kind of thing. I mean, are there people like that on the staff, or is that something it's still up to you to?
They're not on the staff, but they would have a physical therapist or an occupational therapist review your bathroom and say, here's what I recommend. Let's do this, this, and this. And then you and a family member, they'll have some resources. So these are people who do it, but they don't do it themselves. But
It's still up to you to
yes.
understand.
Right, but they usually have resources that they can recommend. Here's what you need to do. Somebody is going to be, they'll walk you through it because they know how to put those in.
And that's not covered by insurance.
No.
It's covered by you.
Yep. Oh, that was that.
What if you don't own your own home?
So you're at Bethany, right? Did I hear that? Are you?
I'm in the independent
Okay.
living.
So they would probably help you, but there might be a charge for that. But that would be a good question to sit down and ask. If I came home from the hospital and I needed something for a short term, or I just needed my bathroom different, how would that happen? So you can find out ahead of time what you would need or not need, and that can help you make decisions.
They might also put you in Bethany for a short time.
Right.
Mm-hmm.
I used
Yeah.
to work at Bethany.
Yes. Mm-hmm.
Yeah.
Right. So if you were in your insurance coverage, the discharge planner would help you with your insurance coverage, and they'd say, I really think you'd get a lot of benefit out of having some nurses around for a couple days, to have the physical therapy around so you can get stronger to go back to your apartment. And that's the nice thing about the complex is it's all right there. And then what they should do is when you're getting ready to leave Bethany to go back to your apartment is to go with you to the apartment and say, okay, what do we need? Okay, because maybe you're not walking as strongly as you were. Or maybe you've got a cast on or something. What's different that we need to accommodate now that you're back in your apartment so that you'll feel safe and secure. So a couple good things that we covered then are there's a difference when you're in the hospital between inpatient and observation. It's really important to think about your finances and have that all organized. You might consider a financial power of attorney so that somebody would have access to pay your bills and get work done if you weren't able to. You don't need an attorney to do that. You can download a financial power of attorney. The power of attorney is just the document. right? You can download that document from the state webpage as well. I actually have that, and both of my kids are appointed as my financial, because I could be driving home and have an accident. The downside of that, or the thing to remember, is that document goes into effect the minute you put it on board. So the minute you sign it, it's actually in effect. The healthcare power of attorney, somebody able to speak for you and make decisions about your healthcare, that only goes into effect if you can't speak for yourself. So I had to trust my son and daughter. And I said, here, I've just given you access to my bank accounts, but I trust you, because I know that they're not going to go in there. But if I had an accident, you know, they have the legal authority to manage all of my accounts. So that's a kind of a point. You want to make sure. And the healthcare power of attorney, once it goes into place, sometimes people only need it for a little while. So you might need it just for a period after surgery. Sometimes the medication might be affecting you, and you really can't speak for yourself. You're really ill. So the power of attorney can speak for you, and then you get better. You're like, wow, that was really a ride I was on. I'm feeling a lot better now. I'm thinking clearly. And then they revoke it. So it can be temporary too, just for when you need it. So those documents are available as well. I will reiterate, the most important thing is not just to only have the document, but to have a good conversation with the person who's going to be your agent, so they would understand, well, if mom, or, you know, some people say that just in general terms, I don't want to be kept alive by tubes. You know, and what does that mean? You know, you could have an IV, that's a tube. So you want to really, what would a quality life mean? What do you want to be able to do? Why, if you were being kept alive by a lot of medical intervention, you know, what would be a meaningful life? Some people would say it'll be meaningful for me as long as I can interact with my grandchildren. And some people might say, if I can't get outside, if I can't do the things I used to be able to do, I don't want to do that. I don't want to have aggressive treatment if I wouldn't be able to get back to that. So it's those kind of conversations about what would be a meaningful life for you. What would be the point where you'd say, don't go past that, because that, for me, that has no value. And every person is different on that, and that's okay. But it's good to be clear with your agent so that they know, in case it happens, they could say, well, mom and I talked a lot about this, and this is what she would want or not want. And it really not only protects you, but it helps them not feel guilty or bad or worry, did I do the right thing? You know, or I don't know what mom would want. Because it can get pretty complicated. Do you have a question?
Me?
Mm-hmm.
I was just thinking.
Because you look like you were thinking hard about something.
Yeah. That's what I was thinking, was that I had healthcare power of attorney on file at ThedaCare.
Yes.
Somehow, I don't know if they input it in the computers or something, that you have have something there. And as I was thinking about that, I thought I should, when I go for my appointment, I guess, check and see just what they have as a power of attorney. I know I've changed it, because a year ago, I got into a situation where I had my daughter and my husband as power of attorney people. Well, in the meantime, my daughter died. My
I'm sorry.
got dementia. So
you need a new one.
I really need to start over.
So that's a really good thing.
Make sure that that I do have the right people designated for that.
That's such
now
a good.
I believe I've got my two sons.
Yes, but you want to double check that. Which one do you have in there? And what happens when people give it to us is we have a scanner. It's kind of like making a copy. It's an electronic copy. And so they actually have a picture of it in the computer.
Oh, okay.
So they'll be able to pull it up and say, okay, well, let's look at it. And here's what you have. And it's a good idea to update your power of attorney every 5 years, or if there's a major event in your life. Or, because as you said, sometimes people have agents that are no longer able to be the agent. And not everybody chooses a family member to be an agent, and that's a good point too.
Some just don't have family members.
Well,
Right?
that's true, yeah.
So my daughter, when I spoke to her, and she's a young woman, but you know, things happen to people, car accidents, and she actually has a friend of hers because she said, who's been her friend forever, she said, I wouldn't want my husband to have to make those decisions. I want him to be able to just be my husband if this happened. My friend, I know, will do what I want. So, but it's not an automatic that it's a spouse or a child. And not every child in a family is the right person. You know, you want someone who can think in a difficult situation and keep their cool. And you want to communicate. If you have other family members, you want to communicate to all of them what the plan is. So if I have three kids and I'm picking only one, then I want to tell the other two this is why. So that if something happened and they had to activate it, they're not there trying to explain why mom chose them. Because that would make it only more difficult, right?
Now, what is the percentage of people that actually do all this?
That's a really good question. I can tell you that in the city of La Crosse, I don't know if you've ever seen any of the publicity about this, but the La Crosse area, the Gunderson Lutheran Hospital System in La Crosse, they partnered up with the Mayo Clinic in La Crosse 20 years ago. They started this. And they've been working on this for 20 years. And in that area, everybody has it.
But they really worked on it.
They've been working on it for 20 years, so it didn't happen overnight. But what we're doing is trying to follow their model and get better from where we are now. Now, right now, what we measure in the hospital at Appleton Medical Center and Theta Clark, the two big ones, we measure how many people have died in the hospital that actually had a power of attorney in place. So that's one way to kind of just gauge. And so that when they were passing, we knew what they wanted. So their wishes were laid out, and we weren't giving them more or less treatment than they wanted to have. And right now, I think we're at like 60-something%.
Oh, that's pretty good.
Yeah.
I think it would be less than that.
Yeah, so that's one way we're trying to get to as good as La Crosse is. But it's absolutely possible to do it by talking about it, and you know, that's really what it is. It's just, do you have one? And if you don't, let's talk about it and get it. But then your wishes are known, and you have what happen what you want.
Because there's a lot of people that, you know, I'm not going to die. Well, I'm sorry, but everybody's going to die. But some people just don't want to talk about it.
Mm-hmm. And it's often sad with young people. I mean, any of us can have a terrible accident or a terrible illness that would leave us unable to speak for ourselves. And that's why I said to my kids, you both need one. I hope, God forbid, we ever have to use it, but it could happen to you, and let's make sure you're protected if it did. But certainly as we get older, we're all going to die, as you said, and you know, most people have a pretty good idea about what they want to have happen or not. You know, but if you don't have it down in writing, it's a lot harder to have that happen. And in your record, and at your doctor's office. And if it's DNR, that you've got the bracelet on. Yep. And people will ask you what that is, and you'll say, this makes sure when I'm ready to go, that my wishes are respected, and I'm not accidentally going to get resuscitated and intubated and in the ICU and have my 5 days before my family says, it's okay, we can withdraw care. Yeah, because that's not a great scenario.